Hi, I'm Dr. Lennox, and I want to talk to you about low back pain. Really popular topic. What do they say? Well, over 70% of the people around are going to have some low back pain at one time or another. And certainly I think there is enough structurally based, anatomically based issues about low back pain that you can read them anywhere and hear about them anywhere. What I'd like to talk to you about is something you may not have heard about. When someone comes in with their calling card of I have a back pain, it can happen from a number of different ways. Usually, the kind of pain I hear about is not something that happened by falling down stairs, not happened by overlifting too heavy or lifting a car or, most of the time when people come into my office complaining of low back pain, it's non-specific. It didn't happen in a moment. It's sort of, they woke up with it, it was progressive, they can't seem to make it go away, Perhaps they've had orthopedic exams already, and x-rays and MRIs, and maybe they have a diagnosis of a herniated disc. There's lots of things about it. But what I want to talk about is what drives the body to produce low back pain. And there are a number of features that can affect low back. The way I look at the low back is it's a talking area. This is where your body expresses something. So my question to your body and to you is, what's your body talking about? Because if we get into that kind of mode of discussion, rather than you have a low back strain, you need ice, you need heat, you need acupuncture, you need braces, you need chiropractic adjustments 3 times a week for whatever, I think that's a very valid model, and I like that model, except that it doesn't really make me excited. I'm much more excited about why would your body choose to communicate with you with pain in your low back. And to what degree? Is it the kind of pain where you have sciatic pain down your leg and you can't get out of bed, you can't stand up? Is it the kind of pain where it just kind of gnaws at you a little bit at a time? It's better when you rest, better when you do that. That's what I'm really interested in, because there are lots of people who can help you with that other kind of pain. So, what is it that drives low back pain in the body? The first thing I always look at is which systems express themselves in through the low back. One of the primary systems, of course, is the digestive tract. There's a valve down at the end of the small intestine, between the small intestine and the large intestine, called the ileocecal valve. It's a small little bicuspid valve, has 2 little flaps, and it's supposed to allow the difference between the large intestine and the small intestine to exist. One's one environment, one's another environment. And sometimes, if your digestive system is distressed, say you're not having enough stomach acid. Perhaps you're eating stuff that your body thinks is just crazy. Maybe you have gallbladder sluggishness. Maybe you have a thyroid problem which makes your digestive sluggish. Maybe you're constipated. That ileocecal valve can get irritated. When that ileocecal valve gets irritated, it causes an inhibition in one of the muscles that holds your pelvis together, called the iliacus muscle. It's a muscle that's just inside the hip here, and it holds the hip, and it allows the hip to have information about where to be when. Because an issue with a muscle is not whether it's strong or weak. The muscle needs to know what you're doing and be able to respond to that. And if that information system falters, then it's going to lock to protect you. So if your upper digestive system gets irritated, it causes an irritation in the ileocecal valve. That will cause an inhibition in the muscle in the low back. That will cause a chemical irritation of the 5th lumbar disc. And there you have the setup. It doesn't really matter what goes on next. Sooner or later, your back's going to hurt. So if you come into me with that kind of environment, I always test the muscles that are involved. And that's one set of circumstances that we'll find. Now, the other interesting thing about the ileocecal valve that I think is worthy of note is that I just don't see acute low backs without an emotional component. And sometimes that's a little hard to explain to people, because the kind of emotional component I'm talking about is suppressed emotions. Usually there's a language that we speak that drives the ileocecal valve to be irritated. And that language kind of goes like this. This is more than I can stand. It's more than I can bear. It's too much. I can't do this anymore. I just need to make it stop. And that's an interesting sort of language. And, sadly, I had to learn this on my own body. I used to make my low back go out a lot. And one of my friends once said, she said, "Nicolai, I've noticed that your low back goes out a lot when you're in emotional stress." And I was totally offended by that. What do you mean by that? But the fact of the matter is that that's what happens. Almost every low back that I see that is not induced by trauma has an emotional component. And so we begin to tell ourselves, this is more than I can bear. And the body, we have a relationship with our body. We have trillions and trillions and trillions of cells that try to give us a vehicle on Earth. And if we're constantly telling one message to our body that's incongruent with our reality, we're going to have some distress. And so the emotional low back precipitates through the ileocecal valve, and it causes the ileocecal valve to get irritated. And it sets it up so you have a spontaneous event where one morning you wake up and you can't get out of bed. So one of the things I ask people is, do you have circumstances in your life that you are telling yourself that you can't stand? Because if you are, that's what your body hears. I always say that the body doesn't have any sense of theater or any sense of drama. Your body's very literal. If you tell your body it's more than you can stand, your body goes on hyper alert and really believes that your life's in danger. And so if you tell your body your life's in danger, tell your body your life's in danger and do nothing to change it, it will do its best to protect you. And one of those protective mechanisms is to make it so you can't get out of bed and you can't go to that place that you're saying you can't stand anymore. And maybe it seems a little esoteric to you, but the fact of the matter is, 37 years of practice, this is what I see. People come in with low back pain. If the ileocecal is involved, there's always an emotional component. And that's what we always talk about, is the emotional ileocecal valve low back. Now, it's an orthopedic event, don't get me wrong. There's real muscle spasm, there's real sciatica, there's real inflammation, and it really, really hurts. So it's not that it's imagined, and it's not that you can go, oh, okay, I'm good, and it all goes away. You still need to do the chiropractic adjustments. You still need to do ice, and oftentimes you'll need very specific dietary inhibitions that are not promoting the inflammatory process in the gut. But you need to know what drives it. Otherwise, you just keep producing it, keep producing it, keep producing it. And I got to tell you, for me, if my low back starts to get irritated, the first thing I do is ask myself, am I under emotional stress that I'm afraid of, that I just don't want to face anymore? That, am I ashamed of something I did? What's going on with me? So that I can get that clear and then start looking at the more physical side of things. That's the ileocecal valve, emotional low back.